The behavioral definition section of your treatment plan is tailored to your individual client's clinical picture.
Next, the clinician and the client set long-term goals. Some examples may include any of these. For example, a goal statement may be interact socially without undue fear or develop the ability to form relationships. Perhaps the development of social skills will be targeted, and there may be others that you develop to fit your client's needs.
In previous sessions, we talked about how your self-talk triggers your emotions.
Right.
We also identified some of the self-talk that contributes to your anxiety before and during social situations. Do you recall some of those?
Yes, and now that I'm aware of it, I see that I do it a lot.
Okay, that's not surprising. So what have you noticed that you're saying to yourself?
I say I'm not going to be able to do this. I'm going to get too nervous. Everybody's going to notice. They're going to think something's wrong with me.
Okay. And does it make sense to you that when you see the situation that way, it looks very scary and you don't feel confident at all?
Yes, I feel I'm not going to be able to handle it and everybody will notice.
And the self-talk makes you feel?
It makes me feel bad and nervous and pretty scared usually.
Sure. And now we also said that if we turn the self-talk into a prediction of what will happen, that it doesn't always line up with what actually happens. Your prediction usually overestimates these bad things and underestimates your ability to manage the situation. Do you remember that?
Yeah, I can see these things don't happen like I thought they would. I just can't stop myself from thinking this way when I'm there.
Well, that's normal. That's the way it usually works, unfortunately. And that's why just understanding it isn't enough.